Gestational diabetes. Gestational diabetes mellitus, GDM, is a type of diabetes that develops during pregnancy. It occurs when the body cannot produce enough insulin to meet the increased needs during pregnancy. The exact cause of gestational diabetes is not fully understood, but it is thought to be related to hormonal changes that occur during pregnancy. These changes can lead to insulin resistance, where the body's cells don't respond effectively to insulin. Risk factors. Several factors may increase the risk of developing gestational diabetes, including age. Women over the age of 25 are at a higher risk. Family history. A family history of diabetes increases the risk. Ethnicity. Women of certain ethnic backgrounds, including Hispanic, African American, Native American, Asian American, and Pacific Islander, are at a higher risk. Obesity. Being overweight or obese before pregnancy increases the risk. Previous gestational diabetes. Women who had gestational diabetes in a previous pregnancy are at a higher risk. Polycystic ovary syndrome, PCOS. Women with PCOS have an increased risk. Symptoms. Gestational diabetes often doesn't cause noticeable symptoms. However, some women may experience increased thirst and urination similar to symptoms of other types of diabetes. Fatigue, feeling more tired than usual. Blurred vision. High blood sugar levels can affect vision. Diagnosis. Gestational diabetes is typically diagnosed between the 24th and 28th weeks of pregnancy through a glucose tolerance test. This test measures how the body processes sugar. Complications. If not properly managed, gestational diabetes can lead to complications for both the mother and the baby. Macrosomia, the baby is born larger than normal. Birth injuries. Difficulty during delivery due to the baby's size. Hyperglycemia in the newborn. The baby's blood sugar may be low after birth. Jaundice. The baby may develop jaundice. Respiratory distress syndrome. Breathing problems in the newborn. Type 2 diabetes risk. Women with gestational diabetes have an increased risk of developing type 2 diabetes later in life. Management. Blood sugar monitoring. Regular monitoring of blood sugar levels is crucial. This may involve daily blood sugar checks. Healthy eating. A balanced diet that controls carbohydrate intake is important. This often involves working with a registered dietitian. Regular physical activity. Moderate exercise is generally recommended, but this should be discussed with a healthcare provider. Insulin or medications. Some women may need insulin injections or oral medications to control blood sugar levels. Frequent checkups. Regular prenatal checkups are necessary to monitor the health of both the mother and the baby. Delivery planning. The timing and method of delivery will be carefully planned, often in consultation with healthcare providers. Postpartum monitoring. After delivery, blood sugar levels are monitored to ensure they return to normal. It's important to note that gestational diabetes often resolves after childbirth. However, women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life, so regular follow-up and lifestyle modifications are recommended for ongoing health. Effective management of gestational diabetes requires close collaboration between the pregnant woman, healthcare providers, and sometimes a diabetes care team. Individualized care plans take into account the specific needs of the mother and the developing baby. For type 1 and type 2 diabetes, please look our channel for relevant videos. Please subscribe to our channel for more informative contents. Thank you for watching the video.